My talk is looking at the future of health. Will our children live to the age of 100? Will they be happy? Will they be healthy? What is the future of health? And I suppose to look at the future, perhaps it's wise to look back into the past, see what has been done, and see what might be in front of us as well. I suppose my question is, are we optimistic about health? Are we optimistic about the future of health? What do people think? I see a lot of nodding heads, which is fantastic. I really, really like that as well. I think there are some huge reasons to be optimistic about the future of health, because so much good is going on at the moment, and so much good has gone on in the past, and the potential for the future is just absolutely enormous. So the Earth, people agree broadly, came into being about 4.6 billion years ago. Was anyone around at that point? No one in this room, but humans essentially started inhabiting the Earth about 250,000 years ago. So a tiny sliver of that brief history of time. And at that point, life expectancy was about 20 years. That's not enormously good. Is anyone under 20 here? We've got a few. So I think about 3 or 4 people in this room would be alive still if we had the same life expectancy as our predecessors. And at that time, there was no concept of medicine, no concept of health systems and medications and rescue helicopters and all that sort of stuff. But I think Hippocrates is well acknowledged as the founding father of modern day medicine. Prevention is better than cure. That's one of the ultimate medical idioms he came out with. And then going through to Galen with the Romans, many other significant advances at that point. Some more recent advances involved things that are really particular to where we are. We're in Edinburgh here. We're in Scotland. People from Scotland invented things such as anesthesia, CT machines, MRIs, penicillin. So we've got a massive history of invention and innovation and ideas worth sharing in medicine here in Edinburgh. We can be proud of. Things that we weren't directly responsible for were Edward Jenner inventing the vaccine for smallpox, a disease that actually wiped out tens of millions of people worldwide and has actually just been stopped following that invention. And Florence Nightingale. Again, some ideas have come from all sorts of branches out with medicine, within medicine, from nursing, from physiotherapy. And I think that's it. If we can curate all our good ideas and to take them forward, that's what successful looks like. So Nightingale pretty much invented medical statistics, some ideas relating to sanitation, ideas on how we actually accumulate and track things. And if we measure things, we can make it better as well. But despite that, and despite all this optimism, we still haven't cured it. I haven't got the most up-to-date medical statistics. But in 2010, death rates worldwide, be that in Antarctica, be that in Greenland, be that in parts of Africa, in fact everywhere, or even here in Edinburgh, were 100%. 2011, 100%. 2012, 100%. 2013, I'm not privy to the data. Has anyone got a guess? So science has advanced. These pioneers like Jenner, like Nightingale, Hippocrates, Galen, all these folks have had great ideas. We've spread it and improvements have been made, but we still haven't cured death. But is death a problem? Not by itself, but I suppose if we've got that ambition of living longer lives, not forever, but longer lives, and healthier lives, and happier lives, fundamentally, if people are happy, I think that's an idea worth striving for. You know? And I suppose here's where we are at the moment. Through the history of time, you can see that life expectancy has not been lower than a snake's belly, but not far off it. So since the time of cavemen and whatever, right up to about 200 years ago, life expectancy was somewhere between 20 and 30, and we've just taken a mean here. It just shows that's progress.
It's a jigsaw.
You can see I've been doing my weights today. But 200 years ago, we got this step change in life expectancy. There's real acceleration. Things are getting better quickly, and you can see that from a start of 25, now life expectancy worldwide is beyond 60. That's a significant achievement. So things are getting better at pace and at scale. Worldwide, it's not the same in every country, it's not the same in every town or even in every community, but things are getting significantly better and real reasons for optimism there. There's a fantastic website called Gapminder, and it looks at global population health and how things are doing and how people are. And essentially this graphic, which is extremely complicated, and please don't follow it, shows that essentially countries used to all be cluttered down here with very low income, very little money that people were making, and also high levels of sickness. So life expectancy low, income low, but suddenly things are moving up to more money, to more health, to more money, to more health, and wellness, and more money here. So it used to previously be the case that everything was down here. The movement here from Europe and from North America and other countries is now clustering up towards there, but can in the future every country on earth, be that Scotland, be that in parts of Africa, Asia, South America, other places that life expectancy is not universally good at present, can we all cluster up towards well and making money as well? Would that be a noble ambition? Is that something that can be achieved? Some people are not optimistic. A lot of people think that it can't be done, but it can. When you look at Rosling's work, when you look at all these people that have studied this in great depth, the reasons for optimism are there, and improvements are almost inevitable. There will always be glitches in the system due to war and due to problems and things such as that, but overall, certainly the direction of travel is extremely positive. And I work as a general practitioner and a sports medicine medicine doctor, and I'm so proud to work for the NHS. I think it's absolutely fantastic. There are so many ideas worth sharing within the NHS. Great individuals, great systems, and I think some real empathy and some real patient-centered care there as well. I showed a picture of my wee daughter, Nina, who I'm hugely proud of. And she's 6 months now, but about a month ago, essentially, I was probably too careless, I was rushing around, and she burnt her hand against a hot kettle and got a scald there. And I was really ashamed. I was massively embarrassed taking her into hospital to be assessed. And just the compassion and the empathy I got from the nurse, and then subsequently the doctor that treated her and helped us get her back to health, were such a blessing. It wasn't just the quality of care, but it was the compassion and the empathy that was there. I was massively grateful for. And I think the NHS does that well. If you look at measures on how the UK and the Scottish NHS is doing against other countries and other areas, then essentially we're doing very, very well. It's effective care. We're doing the right thing by a lot of patients. We're concentrating on what matters to people rather than just doing things to folk. But where we fall down at present, and you can see this is the UK column. So a lot of ones. 1 is good, 11 is bad, and you can see we're doing extremely well in pretty much all variables except healthy lives. And that seems to be something that people are taking forward and promoting health. And things such as decreasing the amount of alcohol drunk, the amount of cigarette smoking, the application of... So real health promoting measures have been taken forward strongly at present, but we've got somewhere to go, and we lag somewhere behind the rest of the world on this. But how about the miracle in Bangladesh? I mean, there's some great stuff going on in Scotland, but I've just come back from Namibia, and there were some great examples of things that are happening. Life expectancy is increasing by more than 1 year every year in Namibia. Well, it was a couple of years ago. If that carries on, people will live forever. Access to healthcare in remote and rural areas is just fantastic out there. So again, some real lessons to me when I was out there. And Bangladesh has achieved something that is amazing. A population of 150 million. In direct contrast to Namibia, massively dense in terms of the population density, perhaps the most densely populated big country on earth. And over the last 40 years, child death, so people of under 5 dying before they reach their 5th birthday, has gone from in excess of 20% to less than 3%. I think that's pretty good. Birth rates have gone from about 6.4 babies per couple to about 2. And that has a huge benefit in terms of increasing life expectancy, but also in terms of child mortality. And that's because people have been reassured that their children are likely to survive. And with that, they're more confident having smaller families in the first place. And because of that, life expectancy, much like Namibia, has just absolutely rocketed. So Bangladesh has gone from being a very low-income country with poor health outcomes to still not having a huge income, but actually having quite good health outcomes. How is Scotland doing in relation to life expectancy? We're widely known as the sick man of Europe. Life expectancy here is the lowest in Western Europe. So although we're doing some things good, there's further room for improvement. And you can see, here we are. You know, in 1850, right in the middle of the pack, we used to actually have the longest life expectancy on Earth as part of the UK 200 years ago. And it's not a genetic thing. You can see we've always been somewhere in the middle of the pack. These decreases in life expectancy in Europe are due to wars and things like that. But more recently, you can see we've slipped. And this blue line is right at the bottom of the pack. Lowest life expectancy in Europe again. We're kind of like the Rangers of life expectancy at the moment. I couldn't resist, I'm an Aberdeen fan. What's driving health outcomes at the moment? What are things that are happening that require us to change? The definition of insanity, according to Einstein, is to do the same thing over and over again and to expect different results. Life expectancy is going up, but we're being outstripped by our Western European neighbours. Things are not as good as they potentially could be. Good can be the enemy of better. And we are seeing four major health trends at the moment in terms of globalisation. So essentially we've got access to information and access to colleagues and resources, and it's essentially a global community. I think this is accepted now. There's also the economic pressures of the recession, of money going less far, of an ageing population that means that probably more money is needed into the system and more value is required. So we're having to get more bang for buck. So there is also this ageing population and also the rise of non-communicable diseases. It used to be that we used to die by getting eaten by things, or getting infectious diseases, or being too cold and things like that. But in Scotland, it's very rare. We don't have saber-toothed tigers any longer. But the non-communicable diseases, like type 2 diabetes, heart attacks, strokes, cancers, these are the things that are killing people. And these are bigger problems not only in Europe, but also right across the world now, and it's increasing. It always used to be the case that many of the good ideas in medicine used to come from Britain, used to come from places like North America, but now it's a much more global thing. So a lot of the good ideas are coming from places like Bangladesh, or coming from the East, places like Shanghai, where I am tomorrow. And it's also about recognizing that innovation is required. More of the same doesn't always work. And a great example is Motorola. They used to pretty much own the mobile phone market. This used to be the case. Does anyone remember this as the primary method of phone communication? Mobiles haven't actually been around for that long, but it's produced an absolute step change in the way that things have done. Did anyone have one of these? So again, very, very popular. But when we went from analog to digital, it created a step change, and those that didn't make that transition were left behind. And this is what we've got now in terms of a real new way of doing things. It's led to substantial improvement. Perhaps not in terms of physical activity, but it's certainly a big improvement in the way that we can communicate and can be accessible and can share information. In terms of the future, what are the absolute certainties? What's definitely going to happen? The world is definitely getting smaller. We know this. We can share information, we can access things, we can collaborate at scale, we can work with other people. Mobile phone. Bruce Keogh said it's the pluripotent stem cell of how things are going within the NHS in terms of there's so many things that can be changed fundamentally by the mobile phone, taking things like pulse, blood pressure, oximeters. You can even get an ECG, a tracing of your heart from a mobile phone now as well. So the technology is advancing, especially through mobile phones. And actually, a future health certainty is a real focus on prevention. Hippocrates said this initially, prevention rather than cure. Luis Suarez, the footballer, accused of biting people on multiple occasions, you know. But a really big thing as well is recognising our patients as our biggest resource. They're not just our patients. They're our partners in helping create health and improve health outcomes for themselves and for other people as well. So if we can involve people in doing things such as walking on a regular basis, it can just make a massive difference. And it's really good for that sense of control and purpose as well. So here's the quiz. Could anything actually be more dangerous than a chair? I'd have thought that sharks would be more dangerous, maybe than snakes or mosquitoes. But it turns out that according to this paper from The Lancet, physical inactivity kills 5.3 million people worldwide. So feel free to get up and run around and jump around in your chairs and stuff like that. So you can see it's a huge public health concern. And if you actually look at stats from Steve Blair in the British Journal of Sports Medicine, it shows that physical inactivity measured as low levels of cardiorespiratory fitness may actually kill more than smoking obesity. So low levels of fitness could kill more than the combination of smoking, of type 2 diabetes and obesity when measured objectively. Data that has no challenges. So that's just incredible. This is something that we can shift fundamentally. It's not something that the world has really cottoned onto. But now this evidence has emerged, it's something that we can actually do at pace and at scale together, and we can do this together. But physical inactivity has some really disbenefits. There are some bad things that can happen. And I've got really bad news for you. If you're regularly physically active, you are 70% more likely to have athlete's foot. And 80% more likely to get blisters. But you get 30% off early death, you do get between 20 and 40% off heart attacks, strokes, type 2 diabetes, depression, dementia. So it's not only good for the body, but it's really good for the brain in terms of getting those happy hormones going. These are all things that are significant causes of not only unhappiness and poor health worldwide, but also have a significant impairment on the budget. Type 2 diabetes costs the NHS in the UK £1 million per hour. So these are the reasons for optimism. Worldwide, we can actually move from many countries here being clustered 100 years ago, being poor and unhealthy, to being more rich and to have better health outcomes. And that can be by looking at these lifestyle type issues and really looking to improve matters with patients, collaboratively using them as a resource to their own health. And things are accelerating. Things are moving quickly and improving all the time. And I think that everyone in this room, and everyone pretty much that has any role in health, or our patients themselves, which we all are, can actually help our own health and can help the health of others as well. So I think real reasons for optimism there. In terms of what are future potential trends, there are things that probably are commonly regarded as certainties, but things that are a wee bit more outside the box, step changes, real differences, things like technology. Mark Stevenson wrote a fantastic book and looks at certain issues, saying that actually there's a capacity to create things that are better than human function at the moment. Before Oscar Pistorius got himself in mischief, the prosthetics that he was using could arguably be thought as being better than human function in terms of actually the pace it could develop. Stevenson also talks about ear implants and eye technology being better than human sight and human hearing as well. So technology is improving hugely. And things like that are on the horizon, better than human function. And genomics as well. There's the potential to know more about people in terms of their DNA and what that could mean in terms of higher risk of heart attacks. If you are at 70% risk of a 70% higher risk of heart attacks, would that influence whether you might eat more sensibly or take regular physical activity, like walking, or stop smoking? It might or it might not, but it would be interesting information to have. Robots are doing surgery now. They are. But things like this are increasing, and on the horizon there'll be some very, very exciting developments that we can't predict. They'll just spring out of nowhere, recognizing that the world now is very different to what it was recently. 25 years ago, there wasn't even the internet. Can we seriously imagine life without it now? So what can we do now as health professionals? These are some ideas from people far cleverer than myself that are said, that just say, you know, if we're open to change, it can lead to improvement. And we don't quite know what that will look like, but it will happen. So if we're open to change, improvement can happen. And without it, if we're closed to new ideas, it's much less likely. For the good of our children, for the good of ourselves, can we not only create health as well as treat disease? Those stats show that, particularly in the UK, we're quite good at treating disease with tablets and operations and things such as that. But can we really actually create health with people as well? Looking at lifestyles, being kind and considerate, and just working out how we can support what matters to that patient as well as what we're looking to achieve ourselves. And really valuing patients as well. I mean, that was so welcome. And I mean, I felt terrible when I took Nina in with her burn to her hand. I mean, I just felt as if I just wanted to shrivel up. But just the compassion and the empathy that was shown, I think, was key to just feeling a bit better. And also, I think, just feeling that it really was an NHS and a health system that truly supported us, which was great. And we can share the data, we can share stories. Everyone in this room, everyone worldwide has probably got an idea or two about how things could be made better within health or education or other things as well. And if you can share these data and share these stories, then that can lead to massive improvement.